Oftentimes, something like modeling can be used as a change to help foster change. Showing somebody with behaviors actually doing something and having them observe that other person, like a model, would help them learn how they can act in certain situations, which behaviors are appropriate, if you will, so that they can get the same positive reinforcement that the other model has gotten as well. This theory then kind of slowly bleeds into cognitive behavioral therapy, and I'm not going to touch too much upon it now because that is the focus of next week's chapter. But you can see how it started with strict behavior and how it's slowly slipping into cognition as well. They're basically where Skinner splintered in the very beginning, rebelling against psychoanalysis and rebelling against some of these existential thoughts. Bandura and some of the older, the later behavioral therapists began including some of those things again. So they started incorporating all the different theories, but with a behavioral base and foundation. All behaviorists believe that people are products and producers of their environment. Okay, so we are affected by the environment, and yet we affect the environment also. And that helps explain some of that interaction between the two. Again, we're trying to give our clients some self-efficiency. We're trying to give them some control. Oftentimes in an environment we feel out of control, but we are trying to show people what they can do with their behaviors within any given environment. We're also trying to increase their personal skills so that they can respond appropriately. Obviously, some behaviors have better reactions than others. By observing the positive behaviors, we can possibly repeat them so that they can help us in the future. Or maybe if we never had known these particular behaviors existed, we can learn them and then repeat them ourselves so that they help us in the future. There are 6 characteristics of behavioral therapy. The first is being that it is based on the scientific method. We use experiments to change behavior. We literally try different behaviors, the same way you would try a different chemistry concoction, just like in the scientific method. So we do experiments to change behavior. All of this is systemic. There's a definite approach to things. We're looking at empirical evidence. We're looking at data. We're looking at things that, again, is observable, things that we can chart down and we can number and we could make notes of. We have goals for our experiments. Our goal is to have the most effective behavior as possible that's going to help us achieve what we want. And like all things with the scientific method, we need to reevaluate and to restudy and to retest and to readjust and revise constantly so we can find a better and better and better solution or behavior to our problem. We deal with current problems and factors that influence them, not historical ones. This is where we're kind of anti-psychoanalytic. We are dealing with problems that are happening now. We're not so much concerned about digging up the past skeletons and evaluating them and analyzing them. We want to look at problems that are happening right now. And one of the ways that we do that is we have a functional assessment. It's a behavioral analysis. It's a way that we kind of look at ourselves and say, hey, what's working? What's not working? What do I want to change? And this is primarily where behavioral therapists work with their clients to determine what are they going to be working on? What are our experiments going to be revolving around? And this functional assessment is going to help us determine where we go. The third thing is that clients engage in actions to deal with their problems. This is something where we do something. We're not just thinking about it or talking about it, we're acting on it. And if we're not acting on it, we're at least monitoring it. This is a proactive technique. This is very action-oriented. And just to give you kind of like a small example, something like role-playing would be a way to kind of act on our behaviors. So you would kind of throw someone into a scenario where, okay, this is how you're dealing with someone who's being aggressive towards you. Show me how you would normally act. And then the person would act how they normally would act. And then you would kind of challenge them a little bit and say, okay, well now try doing something a little bit differently. Change your behavior, and let's see how things might change, how your behavior might change this environment. So that kind of role-playing experiment can then be transferred into the real world. Let's try to apply some of these techniques that we did right here in the session, this actual behavior right here in the session. Let's try doing it out there in the real world. And let's monitor it, and let's evaluate it, and let's collect that data and learn from it. He says, or behavioral therapists believe, that change can take place without insight. We don't need to understand all the things that are going on, all the filters and all the psychological aspects of why we do the things that we do. We just need to know what works for us. We just need to know what brings us the rewards. We just need to know how to get from point A to point B, how to accomplish our goals. So we don't need to completely understand why it all works. We just need to know what works, and we need to do those behaviors that get us there. We believe, as behavioral therapists, in assessing behavior directly, identifying the problem, evaluating the whole situation, and looking for a way to change it. Again, this is kind of that systemic method of really just observing things and coming up with a plan to make a change. And these treatment plans, this is the last aspect of things, these treatment plans are individually tailored. They are unique to the individual based on some of these personal factors. Obviously, based on the problem itself is unique to the individual. And what solutions, what behaviors work for the individual. What may work for one individual, or what might be the end result for one individual might not be okay for the other individual. And, you know, someone, for example, who has anger management problems might be content with just simply screaming at someone versus being physically aggressive with someone. Whereas someone else who doesn't have those behavioral problems may want to work on not even screaming at that person. So once again, these are examples of how things can get scaled appropriately to the individual. And one of the ways that we tailor these programs is through behavioral plans. We actually come up with plans that say, did Johnny do this today? Did Johnny do that today? Kind of things, and ways that we can monitor our success or our failures, ways to observe our behavior. And sometimes just by knowing that we're observing our behavior causes us to think about this, causes us to constantly evaluate our behavior. And then with a little bit of practice, we then know which ones work and which ones don't work, so that we can use our minds to make the right decision that works to our benefit the best. What are the goals? The goals are important in behavioral therapy. We want to increase personal choice. We want to give someone a plethora of options, of different behaviors to deal with any given circumstance. And hopefully the person will be able to choose which one works best for their goal. We want to create new conditions for learning. We want to allow ourselves to learn new methods and new techniques. So we are definitely trying to foster that kind of environment where people can come into the counseling session and try different behaviors and try different techniques that may work for them. And we want to help eliminate maladaptive behavior, things that do not work for them. For example, smoking. If someone's smoking, maybe there's some behavioral techniques that we can come up with that can help them. You know, number one, we need to recognize some of the triggers, aka things from the environment that would cause someone to light up a cigarette. But maybe there's also other kind of behaviors that we can do that will help us break this maladaptive habit. Maybe by a behavior of popping in some gum will help, or maybe the behavior of playing with something with their hands because they, you know, associate some sort of pleasure with their hand movements. Or maybe the behavior of going for a walk, because part of it is going outside anyway. These kind of things might work for the individual so that we can help them break some of these habits. The therapeutic relationship is important. The counselor is a teacher in this scenario. unlike some of our person-centered theories or whatever, the client does not know best. In this case, the therapist knows best. And the therapist is going to tell you how to change your behavior. You are going to need to listen to the advice of the therapist. Okay, you're right. Tell me what to do. Set me on the right path. Teach me these new behaviors. This is a little bit different from some of the other kind of theories that we've been focusing on lately. That's kind of been kind of like loosey-goosey, you know, whatever. It's up to the individual, that whole phenomenological thing. That kind of goes out the window with behavioral therapy. In behavioral therapy, it's very clear that we need to take the advice of the therapist. Clients need to be experimenting with new behaviors. We expect that from them. They will go through the functional assessment with the counselor, determining what behaviors are working and which ones are not working for them. We're going to look at data, evidence, and we're going to kind of practice new things, and then we're going to evaluate that system and see how that's working. Did that work, or do we have to continue to make new changes? Some of the things that we do, we use some techniques. I'm sure you've heard of a lot of them. Reinforcement, praise, attention, giving somebody money or food, help shaping their behavior. We use modeling as a technique to help them change their behavior. The idea of systemic desensitization, where we learn to kind of relax with exposure to something. The idea of flooding, it's kind of also called in vivo, where we give something painful or something maladaptive, and we kind of have them sit in it for a long time, and hopefully they'll get over it. So someone who has a fear of elevators, for example, we would take them into an elevator and we would close the door and we would sit there and wait, and we would talk about how it's feeling, and we kind of, as the word suggests, flood them with this experience, where normally they would run away and never even go in the elevator and run up the stairs, or not even go in the building at all. This kind of experience, this behavior of walking into it and staying in it, may help us change some of our behaviors. Cognitive restructuring, which is going to come up a little bit more when we talk about cognitive behavioral therapy, and coaching. And it's kind of what it sounds like, hey, try this or try that kind of things. All these things kind of blend in together. Again, basically what we're trying to do is we are trying to change someone's behavior from something that is not working to something that does work for them. Oftentimes we have questions that focus on the what, the how, and the when, and not the whys. A couple other theories have this as well, but we are not concerned about the whys. We don't necessarily care why we're doing the behaviors that we're doing. We just want to know which ones work. We want to know how we accomplish our goals, what it's going to take to accomplish our goals, so we can just simply do it. Again, one of the pioneering principles is that we don't need to understand everything. We just need to know what works. And a lot of times, again, with our plans, the individual plans that we've tailored for our clients, and they've helped tailor for themselves, there are contracts. There's behavioral contracts. I will work on this, and maybe attached there may be some reward or some consequences depending on the contract. But it's very clear what the stated behavior is. So we use contracts as a technique. And we also use some form of homework. Hey, I want you to now go out and I want you to practice smiling at 10 different women today. This is your homework assignment. Next week I want you to come back into this office because, again, I know best. I want you to come back into this office and I want you to tell me what happened. We're going to look at the data of what happened when you smiled at 10 different women, because your problem was not getting enough attention from women, or, for example, whatever it might be. So this is just a kind of a rough glance as to what behavioral therapy is, hopefully with conjunction with your readings and some of the questions that I'll pose, we'll get a better understanding of behavioral therapy. And stay tuned for the next video, which is cognitive behavioral therapy, which is just a hop, skip, and a jump away from this. And this is certainly the base of it. So thank you.